STEM work in high-stress environments. Not only is their workload intense, but they also must cope with the stress that comes with constantly trying to prove themselves to their male colleagues. Because of this, it is extremely important for women in STEM to understand the value of their mental health and to be able to identify the differences between stress and anxiety. So, the Women in STEM Club asked one of our student assistance counselors to speak with us about anxiety and perfectionism and how they relate to our overall well-being. Let's see what she has to say.
Thank you so much for inviting me. I've been really looking forward to this. My name is Kathy Lamaro. I am one of the student assistance counselors at the high school. If you have not had any familiarity with the student assistance counselors, we're different from school counselors, where every student is assigned a school counselor. Student assistance counselors were also referred to as SACs. There's two of us in the building. We work with students who are referred to us, and we're mental health workers, and we support students who are dealing with a vast array of issues, everything from like maybe changes in your family structure, adjustment related issues, grief and loss. We deal with a lot of depression and anxiety, substance use, parental substance use, gender and sexuality, identity-based issues. There's a very, very wide spectrum. And I'm also a chair of our school climate and culture committee. I work as an anti-bullying specialist. And I'm also a licensed therapist with the state of New Jersey. So I do psychotherapy on an outpatient basis with adults, and I do that like one night a week. I have a little guy, 16-month-old baby. Well, he's like a toddler now, I guess. And I was a teacher for a very long time before I decided to pursue counseling. So I'm very, very comfortable in education. I feel like education is my life's work, even though I did technically a career change in going from teaching to mental health. So if any of you guys are ever, curious about those kinds of careers, I find them to be extremely rewarding, and I'd love to talk to other people about them. So I'm here today to talk a little bit about anxiety. We are living in a world full of anxiety. I don't know if you guys would agree with that statement, but I think that that's true. Living in a global pandemic, even if you are just watching the Netflix and making that banana bread, it's very anxiety provoking to not know what's going to happen and to have all of our plans be so subject to change. I don't know if any of you guys have any family members who have tried to get vaccinated, but I have two parents who are over the age of 65. So the process of trying to get them vaccines, I felt was like, so, there's not enough, and we have to try to, so we're living in a very, very anxiety laden world. So I think educating ourselves about anxiety is something that we can do to kind of like prepare for life in the world. And especially as speaking to a group of, women who are interested in the STEM related fields, which tend to be highly competitive, knowing about your mental health, understanding your mental health, and understanding how to care for it is, in my professional and personal opinion, it's really like a life skill that I think we need, everybody. So thanks for inviting me here today. I'm going to talk a little bit about anxiety, what it is, what it's not. I'm going to talk about what's an anxiety attack. I'm going to talk a little bit about anxiety and its link to perfectionism. And I have some information also to share with you about anxiety and gender differences, which I think is kind of interesting. Does anybody have any questions for me before I share my screen?
Are you able to share your screen, or do I need to give you the presenter, I think?
It looks like I can. Let's hold on a second here. Oh, host disabled participant.
Okay,
Is that? If not, I can just talk. I can look at my slides and talk.
Does it work now?
Yes.
There we go.
Okay. Do you guys see that? Yeah. Okay. So I introduced myself a bit. Oh, one thing I wanted to tell you is that my office is directly across from room 312. That's the Mr. Dorsey Gordon Mr. Rialto region of the world. They're my neighbors. So if we're ever back in the building, hopefully tomorrow, feel free to pop in and say hi. So a little free association, and feel free to just unmute yourself and shout something out or put it in a chat. When you hear these terms, stress or anxiety, what words, images, phrases come to your mind?
I think I can speak for everybody that if I were to say like, oh, I have a lot of stress, I think the first thing that would come to my mind would be school. So
Okay.
I think just being overwhelmed with work, having so much to do in a short amount of time, or
Mm-hmm.
we're focusing on one particular thing and not knowing if it'll turn out well. Anxiety, I guess, would be determining like the success of something, if it's gonna turn out the way you hoped for or not. A lot of things.
Okay. Yeah, great answers. Anybody else?
For me, I feel like stress is a lot easier to pinpoint exactly the root of where it's coming from. Anxiety can be like a
Mm.
constant kind of like terroring feeling over you, and you can't exactly figure out why.
Yeah, we're going to talk about that kind of being the key feature of that distinguishes, stress and anxiety. Excellent. Anybody else?
To me, I associate anxiety a lot with like overthinking. Stress to me is more
Mm-hmm.
overwhelming. Anxiety is more overthinking about everything you're overwhelmed about.
Yeah, yeah. Um,
It's kind of with me, it's just like plaguing thoughts, just, you know, terrorizing me.
yeah, yeah. I mean, I think it can feel that way. Um, I'm a believer that everyone has experienced situational anxiety. I think it's a part of human development, but we're going to talk about the difference between like what I'm going to call like the lowercase a anxiety and maybe the like capital A anxiety. Um, Excellent answers. Thank you for sharing that. So, are stress and anxiety the same thing? And it sounds like you guys already have a sense of the answer being no, but a lot of times people will use these terms interchangeably. And I think the reason is because experiencing stress, high levels of stress, or experiencing anxiety, they can sometimes show up in our bodies and in our minds in the same ways. And excessive or chronic amounts of either one are unhealthy for us. So stress, as Kaylee, I believe you said this, usually happens in response to a stimulus. It's cause and effect. So it can be a feeling of anger, frustration, distress. It's a normal part of life. And in small amounts, it could be a motivating force. So for example, if I have a deadline, okay, I know that on February 3rd, that paper is due. Well, having that stressor of that deadline helps me to get things done. You know, I could always decide not to turn in the paper on February 3rd and just deal with the consequences of that. But if I don't want that, that knowing that that is out there, that's a stressor that helps me to be productive. That's like an example. This is kind of like a graphic depiction of stress. And some of you guys said this, like overwhelmed. You see like to-do lists and a calendar and like talk bubbles and a phone and a puzzle piece, like this idea of feeling overburdened. That's really what stress is about. Anxiety, on the other hand, is a feeling, and some of you guys have already kind of started to put this together, a feeling of apprehension, nervousness, fear, doom, dread. The source of the uneasiness is not always known or recognized. So when a person is experiencing anxiety, they may appear like they have no real reason to feel that way, but their feelings are still there and they are still real. We're going to talk a little bit later about anxiety disorders that involve chronic, debilitating, and seemingly unprompted feelings of anxiety. We're also going to be talking about anxious thoughts. They can be repetitive and they can be intrusive. And what I mean by intrusive is that they can sort of like pop up and be hard to get rid of, kind of like if you think about like the idea of like an intruder in a space. So some signs and symptoms of anxiety, how it's showing up: feeling nervous, irritable, or on edge, having a sense of impending danger, doom, or panic. There's a lot of physiological signs: increased heart rate, hyperventilation, sweating, feeling weak or tired, difficulty concentrating, difficulty sleeping, it's a big one, and gastrointestinal problems. A lot of people with anxiety complain of stomach aches. In fact, in young children, sometimes, and I don't really deal with a lot of young children, but I do deal with a lot of adults. And so sometimes adults of young children will say, my child keeps complaining that their stomach is hurting and I'm taking them to the doctor and nothing seems to be wrong. Well, I always usually kind of ask questions to sort of have them start to think about whether or not like they could be experiencing some anxiety. So I love this infographic that I found from an Instagram, an artist who depicts mental illness. What people think anxiety is, and you could see it's a circle cut in two halves here: feeling of nervousness or worrying. But what anxiety actually is a whole lot more complex, right? Some of these issues we've already covered, but increased irritability, restlessness, feeling on edge, avoidance, that's really big, of feared situations, a loss of appetite, feelings of guilt or shame. Sometimes people will say, I don't know why I feel this way. It makes me feel so bad about myself. And a ton of physical symptoms. So unlike stress, anxiety does not have to happen in response to a stimulus. It can look like someone is anticipating disaster or catastrophe. The worry can be difficult to control. It may appear greater than what is warranted. So here's like a great example. Over the years at the high school, I have dealt with a lot of students who have had anxiety about coming into the school building. Even though they've come into the school building at 7:15 every single day for 3 years, they still wake up some days with the feeling like they just can't do it. So their level of worry is like, say, here. But realistically, if you boil down the facts, they've proven that every day, it might not be the most comfortable thing for them to do, right? But every day, they've shown up here, they've been able to get through the day. So you see sort of like the disparity between the level of worry and what might be warranted. They may expect the worst even in the absence of evidence or rationale. And that sometimes can be linked to trauma. And what I mean by trauma is like some kind of event in life that puts a person into crisis. It can be characterized by faulty, sometimes irrational beliefs. And what I mean by irrational, I don't mean that in a like a pejorative way. Irrational meaning, like the example I just described, I can't get through the school day. But you have lots of evidence to support the belief that you can get through the day, including the fact that you've gotten through every other day so far. But that belief is still real. In that moment, the person really believes that they can't do it. So some environmental or situational factors could lead to feelings of anxiety. And this is what I'm going to call the lowercase a anxiety. This is the anxiety that comes with life. For example, you have a gigantic test. Or you are, hopefully you guys aren't experiencing any kind of medical issues, but let's say you're having a surgery or some kind of procedure. You could have a lot of anxiety. Well, what if something goes wrong? Well, what if I fail? This kind of anxiety, the lowercase a, situational anxiety, it's lowercase a anxiety because once the issue is resolved, you have the surgery or you take the test, the feelings go away. In some cases, though, feelings of anxiety can interfere with someone's ability to function the way they want to in life. And those, at times, can be diagnosed by a professional as an anxiety disorder. So some of the anxiety disorders, and I know you guys have covered some of these in your health classes, like especially freshman health, or if you've taken psychology, I know Mr. Morrison does some curriculum based on this. There's generalized anxiety disorder, extremely common. Obsessive compulsive disorder, lots of times people just shorten that and use OCD. Post-traumatic stress disorder, PTSD, it's most commonly associated with veterans of the military who have seen combat, but what we know about PTSD now that we didn't know maybe 20 years ago is that trauma is trauma. So it's possible for someone who has lived a very ordinary life to have been exposed to traumatic events and who could be dealing with anxiety as a result of that. And social phobia, or what's also called social anxiety disorder. Working at the high school, I have dealt with quite a bit of social anxiety disorder. It's very common, especially common in youth. So here's just kind of like another like graphic description of the difference between the lowercase a anxiety, a normal reaction to stress, triggered by something specific, has a start and an end, lessens significantly when when you're away from the situation. It could sometimes be a result of toxic situations. But capital A anxiety, those anxiety disorders, they can come out of nowhere. They can be an intense emotional response. They can be ongoing, lasting for weeks or months. It can interfere with your day-to-day life and might feel impossible to control or manage. So anxiety attack, this is another phrase that I think gets thrown around a lot. Sometimes students who are very, well-meaning will say, oh my God, I had such an anxiety attack about that. And what they mean is that maybe they got really upset about something. But an actual anxiety attack is debilitating. It's the abrupt and acute onset of fear, anxiety, or discomfort. Reaches a peak within minutes. It's very short in duration. It feels like it's going to last forever. But one thing I've said to students, I have had over the years students who have had anxiety attacks at school, sometimes like in my office or in the nurse's office, and they might call me up to say, could you come up here to support a student? One of the things I'll say is that this is going to pass in like 2 minutes, so just breathe through it. And it includes at least 4 of the following symptoms. Your heart could race, sweating, shaking, shortness of breath, feelings of choking, chest pain, nausea, chills, fear of losing control, fear of dying in like extreme cases. If you've ever experienced a true anxiety attack, you can't miss it. Sometimes it can be situational. It can result from an experience. Some people deal with anxiety attacks as kind of part of dealing with their anxiety in general. So let's talk a little bit about anxiety and how it kind of shows up in high school students, because some of these dynamics can look a little bit different developmentally. Oops, sorry. Okay, avoidance. A lot of my very anxious students tend to avoid certain things, certain people. Difficulties with concentration or attention. Difficulty staying put, staying in the classroom. With high achieving students, this tends to be less common. Excessive absences or tardies. Fatigue. It's exhausting to feel wound up like this all the time. Physical ailments that might not have a tangible source. And repeated requests for approval sometimes are a lack of confidence. Sometimes these are the ways that anxiety shows up. I actually do a bunch of training with your teachers on anxiety. The most recent one was in November. About 30 teachers signed up to take a workshop on this topic that I geared like specifically towards staff. And they always kind of find it eye-opening because I don't know that people don't necessarily connect all these traits to anxiety. So I always feel good about that because I feel like the more we can educate teachers on it, the healthier it's going to be for students. Grade grubbing, okay, or like, squabbling over that like last point, or those 2 points. Sometimes, that's born out of competition, like wanting to be the best. Sometimes it's born out of like anxiety, like something terrible is going to happen if I do not get an A. Like I cannot tolerate that. I want to talk also a little bit with you guys about anxiety and depression because they are very, very commonly seen together. And there's a reason for that. When anxiety issues grow unchecked, sometimes depression can result. In clinical terms, we call this comorbidity. You might have, if you've read anything about COVID or, they'll say like comorbid conditions. I mean, it just means like two things that are happening at the same time. Therapy and medical interventions can be good resources. NAMI, the National Alliance on Mental Illness, they estimate that up to 60% of those with anxiety also experience some depressive symptoms. And I found this infographic from anxiety.org and this Venn diagram, I should say. And they kind of show the intersection here, the overlap of anxiety and depression. Why they are linked. Not for everybody. Some people experience anxiety and don't experience depression also. For some people, they can kind of like go hand in hand. So anxiety and gender. From the time a girl reaches puberty until about the age of 50, she's twice as likely to have an anxiety disorder as a man. These are the stats. Anxiety disorders occur earlier in women than in men. The NIH reports that generalized anxiety affects approximately 2.7% of American adults. I would argue that that's probably a low number, with women experiencing this disorder at a higher rate than men. Experts did research on gender differences very recently, which was published in the Journal of Psychiatric Research, and they kind of found similar things. Women experience higher lifetime diagnosis rates of anxiety disorders. There's no difference in the age of onset of the illness or the chronicity, like how chronic it becomes of illnesses between the genders. But that women diagnosed with one anxiety disorder are more likely than men to be diagnosed with another one. Women with anxiety disorders, particularly white and Hispanic women, are found to experience a greater illness burden, meaning the illness affects them to a greater extent than men. And women tend to deal with their anxiety by agoraphobic avoidance. Agoraphobia tends to be like agoraphobia specifically is like the fear of leaving the home, but avoidance in general. And men who deal with anxiety oftentimes are more susceptible to substance abuse. I just want to say about these gender, statistics. I'll open it to you guys. Why do you guys have any ideas as to why women maybe are diagnosed with more anxiety disorders than men? What that might be about? Go ahead, unmute yourself.
For me, I feel like the whole thing going around about manly men and like men aren't supposed to show their emotions, so they're afraid to talk about it and afraid to talk to the public about it. So maybe the anxiety disorders are there, but they're not noticed by the public.
Mm-hmm.
I kind of want to add a little bit to that in the sense that, like, men are trying to hold themselves to a higher regard. They shouldn't be worrying about these things because they're supposed to, according to society and toxic masculinity, they're supposed to hold such an air of arrogance and confidence in whatever they do. So any form of anxiety that they have most likely is dismissed right away.
Yeah, I think you guys both bring up like excellent points. I think the way that we socialize, men and women, in a general sense, I'm making a very broad generalization, is different. I think that it's more socially acceptable for, in certain circles, for women to access mental health care or to be very open about these kinds of feelings. So whenever I read these kinds of statistics, I always view them with a critical lens. And so I want to just kind of like put that out there for you guys as well. So anxiety and perfectionism. This is a partnership that is very, very common in high achieving students. I just said. Often it involves avoidance via procrastination, which seems to be contradictory. More serious cases can include chronic tardiness or absences to avoid like assessments. Like I've worked with a bunch of students who they will study, they will prepare, and they wake up on that day of that test and they say, I can't do it. So what are they going to do? They're going to come in late after the test has already taken place. Okay. Oftentimes it's rooted in what's called faulty cognitions or just irrational beliefs. They don't believe they're prepared, even though they have lots of evidence to support the idea that they are. I broke it down here into kind of like as a counselor and therapist, how I kind of like deconstruct this for people. So you kind of have to start in the middle. A student might come to me and say, I keep on procrastinating and I'm just making things worse for myself, but I can't get off the merry-go-round. It's like, I don't feel like my work is going to be good enough, so I procrastinate doing it, and then I just find myself kind of in a loop. So the beliefs that underpin that are, my work is not going to be good enough, and I'm going to fail. Even if I don't like fail with like an F, I will fail in the eyes of my teacher, my peers, or my parents. So I've worked in Montville since 2008. Oh my God, such a long time. And I worked in education for 6 years before I came to Montville. When I was a teacher at the high school, I used to teach English 12 honors, which is a course now that Dr. K teaches. He and I, a couple of years, we did it together, but that course was like my baby. I used to have students who used to use the term Asian fail. Have you guys ever heard that before? Okay, so there was a group that graduated in like 2013, 2014 this was like a part of their lexicon, that they would use the term, quote, Asian fail to kind of parody what was a real belief they felt was imposed upon them, that if they got less than an 85 in the view of maybe their parents or their community, that was actually an F, or like that was considered like not like a failure. I don't know if you guys have found any truth in that, or if you've ever heard anybody use that phrase, but it's kind of like, it really pertains to this. So because I think that my work isn't going to be good enough, and because I'm afraid to fail, I procrastinate because I don't want to deal with that. Well, what's the effect of that? Well, one, temporary relief. Okay, like, oh, okay, I don't have to do that right now. But as the deadline looms, the anxiety increases. Now, where I've had maybe a week to complete this assignment, it's like 2:00 in the morning and the assignment's due at like 8:00, and it becomes this self-fulfilling negative outcome. In the worst cases, I have worked with some students who kind of like can become paralyzed by this, meaning they stop producing work altogether, they stop meeting deadlines. Those are like the most severe cases. As I said before, in the example I used from 2013, culture often plays a role. Well, why? Because perfectionism, especially when you are talking about your academic life, well, that can be seen as a virtue. Okay, if you think about successful people in the world, many of them are perfectionists, right? Sometimes that could be connected to parental expectation, either expectations that are directly, communicated or maybe perceived. And they can blind individuals and parents to the detrimental effects of anxiety or the indicators of disordered anxiety. A lot of the education I do with parents is to kind of like help them to understand the difference between these two things. I found this this picture here to kind of like describe traits of perfectionism. So you have, like, if you see the unrealistic standards, right? Like, how's she going to get up to the top of that hill? The highly critical nature, that's the person on the right who's cutting the grass with the scissors. And then the procrastination and the fear of failure on the side there. So sometimes, and I wanted to include this to you guys, for you guys, because I wanted to show you a little bit of how I explain it to teachers. This is a common question I get. How can I tell when anxiety is causing this dynamic? Like the student maybe avoiding my class to get more time to complete an assessment, or asking for like lots of extensions, as opposed to a student who's just looking for an unfair advantage. Well, I always say it depends on how much work the student is doing. When anxiety is driving, the students are working. And sometimes it's like beyond the point of what's practical. Like I've actually said to students who are caught in this dynamic, like, you're oversaturating yourself. Like you can't absorb much more than this. Like you can't study for 7 hours for a test. Your brain can only absorb so much. In the most severe cases, no amount of preparation is enough, and the self-confidence is significantly kind of compromised. But isn't perfectionism a good thing, right? Well, it depends on how it's affecting you. Is it motivating you to give your best effort? Is it helping you to set and achieve your goals? Well, if it is, then your perfectionism sounds pretty constructive. Is it paralyzing you? Is it making you feel like nothing you produce will ever be good enough? If that's what your perfectionism is telling you, then it might not really be constructive for you. I would encourage you to kind of like spend some time looking at that. Asking yourself those questions honestly is a really good exercise, and a counselor is a great person to help you do that exercise. You know, we also have a lot of anxiety represented in popular culture. Historically, anxiety has been used as like a punchline. You have these anxious, perfectionist characters that are depicted as like funny, they're quirky, and their obsessive or compulsive traits are the object of humor. So we've got Monica from Friends over here, Miss Pillsbury from Glee. We have Sheldon from The Big Bang, and I don't know if you guys, I hope you guys know Danny Tanner from Full House. I know they rebooted it, so you guys should recognize him. He was always, everything had to be clean. He was always washing something. Today, though, we have evolved a bit. I don't know, do any of you guys watch a show on NBC called This Is Us? Okay, so one of the main characters, it focuses on a set of triplets and their life, and their history and all that. It's so good. But one of the main characters, Randall, who's an African-American actor, he's depicted by, oh my God, I'm blanking on the name of the actor. Totally blanking. Sterling K. Brown, sorry. Deals with anxiety, and particularly anxiety attacks. And his mental health is like a theme of the show, and I think it's treated like really well. Not like a, you know, you see him struggle with it, and one of his children actually shows the signs of beginning to struggle with it, but it's treated as like a part of him, and he does lots of things to work on his mental health as part of being a very healthy person. I mentioned some of this in the beginning. You know, you can't talk about anxiety without talking about the time that we're living in. We've got all of the criteria right now for anxiety to be present: fear, unpredictability, difficulty making plans, so many contingencies, so many obstacles in the way of human connection, frustration around information, right? We want to know what's going to happen, and we don't always have that info. So what works? Well, kind of like, and I've said some of this before, counseling can be great. Anxiety can really, really put a cramp in your life. But the good thing about anxiety is that it is really possible to do a lot of work on it so that it becomes much, much less invasive in your life. And a lot of that counseling involves identifying the faulty beliefs that your anxiety tells you, disputing them, and replacing them with effective beliefs. So some of the things I say to students in my office all the time is that Anxiety will tell us things that simply are not true. Anxiety will tell us that every decision needs to be made, or every piece of information needs to be known right now, or else I can't move forward. Not true. What really works for anxiety is what's called the cognitive behavioral approach, which means change your thinking, you change your doing, then you change your feeling. Chipping away at avoidance, learning how, gaining that awareness. Like, if I avoid this, I'm just going to make it bigger and larger in my worry account. So if I can plow through, I'm going to take away the power that this worry has over me. And educating parents, teachers, you guys about anxiety. So the winning combination, in my opinion, is therapeutic interventions, family support, and school-based supports. So thank you so much. Do you guys have any questions for me or about any of the information I shared or anything related to this? Feel free to unmute.
I just had a question.
Yeah.
How would you describe anxiety attacks differing from panic attacks?
So, in a lot of ways, they're the same. I think that what differentiates them is sort of like the underlining feelings that that cause that acute response. It's really like a super technical difference, but there's much more in common than there are difference, if that makes sense. Also, people who experience panic, in my professional experience, it almost seems less connected to environmental things than anxiety can. Does that make sense? Panic, I think people who experience panic disorder, they can feel like it can literally slap them out of nowhere. Like I worked with a client once who had a panic attack in a bookstore. And she was like, I was just looking at the books. I wasn't thinking about anything. Now, I think that there was probably other things going on that she wasn't super aware of. Anxiety seems to be more at like the front of your mind. So anxiety attacks tend to occur more with people who are experiencing things that they're like really ruminating about, thinking about, those intrusive thoughts. But there's a lot of overlap. Great question. Anybody else?
Well, if no one has any more questions, Ms. Lamar, would you mind putting your information in the chat? Because I was just going to say, if you want to talk about any things in this presentation, or if you're just going through a rough time, I'm sure Ms. Lamar would love to speak with you, or any of your guidance counselors. So her information is in the chat, because with everything going on, it's really important that we reach out. And I just really want to thank you, Ms. Lamar. This was an amazing presentation. I think it was very helpful for everyone. So I just want to thank you on behalf of everyone.
Oh, you are quite welcome. Thank you so much for inviting me. Help us to normalize taking care of your mental health. I think as, progressive, innovative women in a like competitive field, I think that your generation can really sort of be the change makers for helping to normalize and destigmatize mental health, and helping us to kind of create a world where taking care of your mental health is on equal footing with taking care of your physical health. So thank you again. And let me know if I can ever be of any assistance.